Back. In the chapter of health programs in India, in today's session, we will be discussing about dengue fever or dengue hemorrhagic fever. The National Vector-Borne Disease Control Program is an umbrella program. It is dedicated for the prevention and control of 6 vector-borne diseases. We see that the National Vector-Borne Disease Control Program, it is dedicated to the control and prevention of 6 vector-borne diseases. They are malaria, filariasis, dengue, Japanese encephalitis, Kala Azar and chikungunya, out of which we have discussed about malaria, filariasis, Japanese encephalitis and Kala Azar. This session will be exclusively given for dengue. Beginning with dengue fever, an outbreak of dengue fever was reported in Delhi in 1996. So we see that an outbreak. What is an outbreak? Outbreak is nothing but an epidemic of dengue fever. What is an epidemic? Epidemic is nothing but more than expected normal frequency of the disease. For example, if you are expecting 100 cases in an area in that specified period of time, then it becomes a endemicity. And if the cases are 100, you expected 100 cases. And how many cases did you get? Approx 100. Then it is an endemicity. If you expected 100 cases, but then the next year in that same period, there were about 10,000 or 1 lakh cases, then it becomes an outbreak or an epidemic, more than expected normal frequency of the disease. Then such an outbreak or such an epidemic was observed in Delhi in 1996. Since dengue has also been reported from the other states, in view of this outbreak, we see other states also reported the dengue. So as a view of this outbreak of the disease, the guideline for the preparation of contingency plan in case of epidemic of dengue was prepared and sent to the states. So we see that in respect to this, so they made a contingency plan. So what is contingency? You are expecting something to occur, but we are not very sure this will occur. So we are just preparing a plan so that if in case the further outbreaks or epidemic occurs, we should be all prepared and planned. So they prepared a plan, a contingency plan, and they submitted to the all the states. They sent that plan. What did that plan include? It includes the identification of an outbreak. We should be focused on the identification of outbreak, demarcation of the affected area, case management, vector control, information, education and communication activities about the do's and don'ts for the prevention of dengue, monitoring and reporting. So guys, we see that we need to identify. In the first place, we need to identify that outbreak, followed by demarcation of that affected area. That affected area needs to be demarked. For example, Delhi. The outbreak was in Delhi. So we need to identify that it is an outbreak. That is how we need to compare the records. Previous year, 100 cases were there. This year, 10,000 cases are there. So we identified that it is an epidemic, followed by demarcation of that affected area. This is the area where there is an outbreak. We demarcated the area. Then case management and vector control. Case management, we need to perform the early diagnosis of the people and give them a complete treatment, thereby managing the case. And vector control, so we need to use these sprays, then we need to wear full clothes, insecticide treated bed nets, all of those bed nets and larvivorous fishes. So these measures can be taken for the vector control, followed by the information, education, communication activities, what to be done and what should not be done for the prevention of dengue has to be given, followed by monitoring and reporting. We need to monitor the area and report the cases to the surveillance centers. So this was all about the preparation of the contingency plan for the outbreak of a dengue epidemic. Outbreak or a epidemic of dengue fever. Followed by the Government of India has identified 521 sentinel surveillance hospitals with laboratories. So we know there are sentinel hospitals, surveillance hospitals with laboratories, and there is another category where there is sentinel hospitals without laboratories. So what are these sentinel surveillance hospitals? Even in the previous video I told you, these sentinel surveillance hospitals are some specialized hospitals which are having high quality data. When a particular disease occurs and we want a high quality data is needed that cannot be obtained through this passive systems, then we set up this sentinel surveillance hospitals. We perform the selected reporting units. There is high possibility of seeing these cases in question. Good laboratory facilities will be given. Experienced, well qualified staff will be allotted in these areas, and if there is any once they collect the data, they are the one who will notify if there is an a certain disease outbreak is there. So these are the people who are highly qualified staff and having all the facilities, experienced, well qualified staff having the laboratory facilities, who will collect the high quality data about a particular disease and notify us. So there is the Government of India now has identified 521 sentinel surveillance hospitals which are present with laboratories. So well equipped laboratory facilities are also given. Next, further, for the advanced diagnosis of the disease, 14 apex referral laboratories, okay, they refer, go to this laboratory, get this procedure done. So referral laboratories have also been identified and linked with the sentinel surveillance hospitals. So these laboratories, advanced laboratories, they have been linked with the sentinel surveillance hospitals. And addition to this, the IgM capture ELISA test kits, you can see here, dengue IgM capture ELISA test kits have been provided through the National Institute of Virology, Pune, free of cost. For the early diagnosis, the ELISA-based NSI kits have been introduced under the program, which can detect the cases from the first day of infection. So now they have modified this ELISA kits with the NSI kits, additional NSI kits, which are more advanced, and they will detect the cases from the first day of infection itself. Whereas this IgM capture ELISA test will detect the cases from the 5th day of infection. So there is an advancement. The NSI will detect the cases from the first day of infection, whereas the ELISA NSI first day, ELISA will take up to 5 days. Okay, at least the infection should be present from 5 days for it to detect. Moving on to the strategies of dengue fever, they include case surveillance, case management, vector management, outbreak response, capacity building, behavioral change communication, intersectorial coordination, monitoring and surveillance. So let us just see what each of it contains. So the Government of India now has taken the steps for the prevention and control of dengue, so which is nothing but the strategies. That is, they monitor the situation through the reports which they receive from the state health authorities. After the reports are given to them, they start monitoring the situation. So the main components of this plan for the prevention and control of dengue is surveillance. The disease and entomological surveillance have to be done. The disease surveillance as well as the entomological surveillance has to be performed. Case management by these laboratory diagnosis, and also the clinical management based on the signs and symptoms, diagnosing the case and giving them the proper treatment. Then the vector management, wherein the environmental management for the source reduction, like I told you earlier. So you can see here, spraying and then using insecticide treated bed nets, mosquito nets, and then vaccinations. So the vector management, environmental management for the source reduction, chemical control, personal protection, okay, the personal protection and legislation. followed by the capacity building. Capacity building, okay, we forgot this outbreak response, right? Outbreak response, where there is an epidemic preparedness and also the media management. Using the various media, the information and education has been given to the community. And the capacity building is the training, strengthening the human resource and operational research. We are giving the training, we are strengthening the human resources, we are improving their skills, their knowledge, and operational research has also been encouraged. Follow it. We have the behavior change communication. Okay. We have behavior change communication, wherein the social mobilization, information, education, and communication has been carried out. Intersectorial coordination, we are coordinating with the ministers of urban development, with the ministers of rural development, the panchayati raj, surface transport, education sector. We will, coordinate with these other sectors. Intersectoral coordination has been done for having a better implementation of the program to prevent the doubling of the services. We have this intersectorial coordination, followed by monitoring and supervision, where we analyze the reports, we review them, we perform the field visits and get the feedbacks from the people. Okay, monitoring and supervision. So with this we come to an end of dengue fever or dengue hemorrhagic fever under the National Vector Borne Disease Control Program. I hope everything is clear. If you like the video, hit the like button and subscribe. Thank you.